You love them, but their refusal to get help for depression is tearing your family apart. What if arguing, pleading, and giving ultimatums are the very things pushing them further away? Their refusal often isn't stubbornness. It's a direct symptom of the crushing fatigue and hopelessness of depression. On top of the illness, a paralyzing fear of judgment and shame often stops them from even starting. Next, we'll show the real reasons for refusal, the communication that works, and the steps you must take to protect yourself. So, why do they refuse? The most shocking reason is a medical condition you've likely never heard of. It's a neurological condition called anosognosia. It means their brain genuinely cannot perceive that it is ill. Arguing is like debating color with a person who is colorblind. Your realities are different because of the illness. Another major barrier is a previous bad experience. One therapist who didn't listen can create lasting distrust. And never underestimate the practical walls: cost, insurance, time. To a depressed mind, these feel like mountains. Understanding these barriers shows why our instincts so often fail. First, let's cover exactly what not to do. Pressure only amplifies their internal feeling of being a broken burden, increasing their shame. Trying to use logic fails because depression isn't logical. It dismisses their real feelings of hopelessness. And taking over completely disempowers them. The goal here is collaboration, not total control. The key to unlocking a real conversation is validation. This does not mean you agree, only that you hear their pain. Instead of saying, "You need to get help," try, "I am worried about you because I love you and I see you're struggling." Not, "You should find a therapist, but I found 3 who take our insurance. Can we look at their sites for 10 minutes?" Sometimes the message is better received from another person. A trusted doctor or a respected relative can often help. Don't tell them why they should change. Ask what they miss from their life. Connect getting help to their goals. Notice the pattern here? We are shifting from confrontation to collaboration, from telling to helping them take one small step. But this is exhausting. Supporting someone who resists help takes a massive toll, leading to caregiver burnout. You cannot pour from an empty cup. Prioritizing your own well-being isn't selfish. It is a requirement for survival. But what happens when their refusal starts to damage the family's stability, finances, or emotional health? What can you do then? This leads to the hardest part: setting firm boundaries and allowing natural consequences to happen. A boundary is not, "Get help or I'm leaving." It's, "I cannot pay your bills if you are not taking active steps for your health." Sometimes the discomfort of a consequence is the only thing that creates the internal motivation for real change. You also must understand your legal limits. Unless they are in immediate danger, you cannot force them into treatment. So when direct talk about depression fails, there's one more strategy. Go indirect. Focus on a symptom with less stigma. Suggesting they see a doctor for their insomnia can be a much easier yes to get. Recall anosognosia, where they cannot see the illness. That medical fact is what gives you permission to stop blaming yourself. The best approach combines gentle I statements with practical help that removes logistical barriers. Let's bring this all together. Your loved one's refusal isn't a rejection of you. It's a symptom of a complex illness. Your power is not in force, but in a strategic shift, from pressure to partnership, from argument to empathy. While offering this new support, you must fiercely protect your own well-being. This is your parallel path to sustainability. This path is long, and you can't walk it for them. But by changing your own steps, you make it easier for them to choose to walk with you.